Good evening, everyone, and welcome to another series of International Dermatology Education Foundation educational series. This week, we are very lucky. This is our third program, and we're going to finish the week with a special edition on maximizing the benefits of multi-weight hyaluronic acid antioxidant complexes to enhance skin rejuvenation. Now, also, we have a special treat tonight. We have two stars, Dr. Ted Lane from Austin, Texas, and Dr. Heather Woolery-Lloyd. She is the Director, Skin of Color Division at University of Miami in Miami. So today, really a special night. We have two great speakers, and I like to thank our supporter, Beiersdorf, for making this possible. Remember, they are the makers of Eucerin and Aquaphor. So before we begin, if you're having issues hearing the webinar, you can listen to the presentation using your telephone. Just select phone call in the audio pane and the dial-in information will be displayed. If you're having technical issues, please submit your question in the questions pane on the right-hand side of your screen. At the end of this webinar, a survey will pop up in your browser and will be emailed to you within a day or two. We would greatly appreciate if you could fill out this very short survey. Within 1 to 2 days of the webinar, a certificate of attendance will be emailed to you. Now, as you know, IDEF, International Dermatology Education Foundation, is a nonprofit organization whose principal mission is to raise awareness and improve dermatology care all over the world through education, especially in underserved areas. As you may know, we started our mission during COVID, virtual programs, and we have been now all over the world virtually, not only in US, but in Canada, in Latin America, in Europe, as well as Southeast Asia, as you can see some of the programs from the past. Also, please stay up to date with IDEF Education Series webinars at LinkedIn, at Facebook, as well as Instagram. So we're gonna start tonight with Dr. Ted Lane, who is a board-certified dermatologist. He is also the Chief Medical Officer, Sanova Dermatology at Austin, Texas. Welcome, Ted. Please take it over.
Thank you so much, Dr. Kircik. I'm so excited to be here. And again, thank you, Beiersdorf, for sponsoring this. We are going to talk about their new face line. So Eucerin has had body in the United States for a long time, and now they're finally bringing their face line, and they're calling it Immersive Hydration. So that's the name of the whole line. So Eucerin Face Immersive Hydration. We're going to talk about maximizing the benefits of multi-weight hyaluronic acid and antioxidant complexes to enhance skin rejuvenation. Now, I have to tell you, this has been out for a little while now, and I recommend this very frequently and consistently to a lot of my medical patients when I'm giving them retinoids or some other type of topical that may cause irritation, because I feel very comfortable with the ingredients and the formulations here, and I know that they will help to improve tolerability of the topical therapeutics that I'm using, but also in and of themselves, they have great ability to improve the health and the appearance of the skin as well. So this is the agenda. We're going to talk about the company Beiersdorf. We'll talk about moving into skin hydration and mediators of facial xerosis, which many of you will be familiar with, but it's a good idea just to get the foundational knowledge as we move into the role of hyaluronic acid in the skin moisturization and appearance. Then we'll talk about how different molecular weights of HA matter in terms of both what they do for the skin and how they can be delivered into the skin. So that's important. We'll talk about the role of antioxidants as well in addressing free radical skin damage. Then I will hand it over to my friend, Dr. Woolery-Lloyd, who will go into the data supporting this wonderful line of products. We'll have summary at the end, and then we will be available for questions as well. Okay, so Beiersdorf, pioneers in skincare, founded in Hamburg in 1882. The core brands, Eucerin and Aquaphor, as we know. Nivea is here as well, Coppertone, of course. Hansaplast, many of us aren't very familiar with. And then La Prairie is their kind of ultra prestige line along with Chantecaille, but there's also other brands that are available across the world. So this is a multinational company that does so many studies. I've been very fortunate to see their study center in Hamburg And it's very impressive how they do their own internal studies with such great technology and have 44,000 international participants as well, because they don't just do the studies in Hamburg, they do them across the world. And indeed, in the United States, they have an innovation center, 32,000 square foot innovation center in New Jersey, where they have a consumer sensory panel and a good medical manufacturing processes laboratory. So they have 60 scientists. So really, this is a German company, but they have a very international presence, including a very large footprint in the United States. So now let's talk about skin hydration and mediators of facial xerosis. As we know, xerosis is a common skin concern that affects all of us are affected by it at some point during our lifetime. We can't just moisturize every day all of our lives. There are endogenous and exogenous factors that contribute to xerosis, and you can see on the right the endogenous factors. There is ceramide deficiency, which can be delineated by skin type as well as genetics, climate as well. Filaggrin loss of function mutations, again, usually related to genetic issues, deficiency in aquaporin channels, insufficient perspiration, pH dysregulation, and then medical conditions, as we are very familiar with. Inflammatory skin disease can easily lead to xerosis. And then there's the exogenous factors, the exposure to the harsh chemicals, excessive washing, those of us who live in low humidity climates and experience seasonal changes. I live in Austin. Dr. Willery Lloyd lives in Miami, so we don't experience much seasonal change, but many of you do, and I am envious if you do. And then we have heat and pollution, exposure to allergens, and then medications as well. Both of these factors, these classes of factors, lead to xerosis, which can present as dry, rough, and tight skin, leading to an increased number of fine lines and premature wrinkles as well. It is something that we definitely try and mitigate. Now let's talk about hyaluronic acid. It is an incredible molecule because it retains moisture with the ability to bind up to 10,000 times its mass in water. It is produced both by keratinocytes and fibroblasts, and it is a glycosaminoglycan. It is part of the dermal matrix. It's what gives our skin the turgor, and it is what is present between the fibroblasts and the collagen bundles. All of it is those glycosaminoglycans, which are so important for skin health. And they do so much more than we think, right? As we are learning now with the latest science, glycosaminoglycans are important with signaling within the skin. They have many different functions, but importantly, they reduce the appearance of aging skin. They help with xerosis, obviously improve the appearance of fine lines and wrinkles. Otherwise, we wouldn't have hyaluronic acid fillers, would we? Now, there are different ways that hyaluronic acid is unfortunately degraded in the skin. There is the exogenous way, which is the photoaging way via environmental insult. So physical degradation of hyaluronic acid via free radicals, and that can be induced by the exposome. Everything that we encounter on a day-to-day basis can lead to an increase in our free radicals and alter our redox homeostasis. So we are going to talk about that a little bit later. And then there are chronological aging and metabolic changes that, as we age, unfortunately, we both experience a decrease in hyaluronic acid synthesis and an increase in hyaluronidase activity, which is that enzyme which breaks down hyaluronic acid. So we have lots of reasons why hyaluronic acid is degraded in the skin, and what we need is to be able to replenish it from the outside in, but also induce more hyaluronic acid synthesis and prevent its degradation as well, which is what these wonderful products do, and we'll go through that. So the hyaluronic acid equilibrium is present in our skin, right? We're always replacing and replenishing our hyaluronic acid. There are hyaluronidase, I should say, enzymes, of which there are 6, but the most active is hyaluronidase 1. It hydrolyzes hyaluronic acid of high molecular weight into low and medium molecular weights. And the increased expression is seen in both chronological and photoaging skin. So unfortunately, it leads to decreased hyaluronic acid concentration in the skin. But we need to understand how the molecular weight, as we think about these different products that have hyaluronic acid, many of them just have a single weight, and it's usually a medium to higher weight hyaluronic acid, but the molecular weight really does matter as we think about delivery and functionality in the skin, because the high molecular weight hyaluronic acid really stays on top of the skin. and it acts almost like a moisturizer, right? It kind of seals in the water, and it also acts as a humectant for the very higher layers, the stratum corneum and the upper layers of the epidermis as well. So it has two different functions, but really just acts at the very top, whereas that very low molecular weight hyaluronic acid is able to penetrate and act as that wonderful humectant that we attribute hyaluronic acid to. That all of that functionality is really that low molecular weight hyaluronic acid. So it makes a lot of sense to have a product that includes a high molecular weight to seal in the moisture and a low molecular weight to increase the humectancy and kind of absorb water. Those two work very well, and those two are kind of what we attribute to a good moisturizer, isn't it? The ability to reduce the transepidermal water loss while increasing the water content of the epidermis is what we think of with the moisturizer. Now, as Beiersdorf was kind of formulating this line of products, they needed to figure out what kilodalton weight of the low molecular weight is the best one to include. And as you see here, this is kind of impressive because this 52 kilodalton low molecular weight hyaluronic acid actually increases the biosynthetic capacity of hyaluronic acid production by epidermal keratinocytes. In other words, not only are we replenishing the hyaluronic acid in the skin by using a low molecular weight, as I mentioned, it dives down into the epidermis, but that acts as a signaling molecule for keratinocytes to produce more hyaluronic acid itself, over 200%. So it is a biologically active molecule, as well as being a very important glycosaminoglycan and a very important humectant. So now I'm going to stop and we're going to talk about a quick polling question, guys. Okay, everyone ready? Most facial skincare products on the market today contain high molecular weight hyaluronic acid only. Is that true or false? So remember, what's unique about this line of products is that it's multi-weight HA. Many of the products that are available today that are not this line, other competitor products, have just one molecular weight. Is it high molecular weight? Is that true or false? So we'll give you a few more seconds, and I think we probably have had enough time. True, exactly. Very good, guys. Everyone's listening. That is exactly right. It is the high molecular weight hyaluronic acid, which is not bad. It acts, as I said, as that kind of moisturizer. Essentially, it's sealing in the water. So it's not a bad thing to have the high molecular weight. But what's wonderful about including that low molecular weight is that you start getting that humectancy as well, and you trigger the keratinocytes to make more hyaluronic acid as well. We talked about how that exposome, right, all the endogenous and exogenous factors that lead to skin aging all kind of work through reactive oxygen species, so or free radicals. They damage the skin by damaging the DNA in the skin cells. So they go straight to the nucleus, they damage the DNA. We have DNA repair enzymes, thank goodness, to help with that. But unfortunately, that damage can overcome the innate ability to repair the DNA, and then we get more and more DNA damage, which not only can lead to photoaging, the phenotypic changes of photoaging, but also the precancerous and skin cancers that we deal with on a daily basis. They damage skin cell membranes with the phospholipid bilayer. They damage all the stuff between the cells, the collagen, elastic, hyaluronic acid, and then they stop the production of HA and collagen, and they increase the breakdown of both of those. And of course, then we start getting what's called inflammaging, right? The inflammation of aging skin is all related to free radicals. So we have to focus on those. And how we do that is via antioxidants, right? As we know, antioxidants are so important, both antioxidants that we take in by mouth, but also antioxidants that we apply. Thank goodness we have endogenous antioxidants to help with our homeostasis. And those include glutathione, uric acid, alpha tocopherol, which is vitamin E, squalene, and CoQ10, which is a very important antioxidant, but also something that we use topically in skincare as well. And there are exogenous antioxidants that we use. Everybody knows about vitamin C and all the different forms of vitamin C. Vitamin E, which kind of stabilizes vitamin C and is super important, especially in that lipid bilayer. But then there are a couple of others that are probably you haven't heard very much of. Glycerotenic acid, which is a licorice root extract. But what about glycine saponin, which is a soybean germ extract? Those top two are actually included in these products. And what these antioxidants do is that they donate an electron, right? The free radicals have an unpaired electron. They're very unstable, and they're grabbing electrons because they want to get back to stability, right? Entropy is bad. We want to get back to stability. And so they are grabbing electrons wherever they can find them, but that leads to a cascade of free radical formation. And if we have a molecule that very easily donates an electron but is itself stable, then we can stop the free radical cascade, and that's what antioxidants do, and why these are such important molecules to not only maintain our health, but also to reduce the appearance of photoaging. When we think about glycerotinic acid, its main contribution in this line is that it inhibits endogenous hyaluronic acid, hyaluronidase 1. So it reduces the degradation of hyaluronic acid. Glycine saponin, on the other hand, increases the production of hyaluronic acid. And alpha tocopherol, or vitamin E, stabilizes both. And then we also include vitamin C in a couple of products here as well. So we have a whole panoply of antioxidants that work well for specific purposes to add to this hyaluronic acid-based immersive hydration line. This is just showing you in vitro what the addition of glycerotinic acid does. When you have the black line is hyaluronic acid plus its breakdown enzyme, hyaluronic acid, hyaluronidase 1, and you can see the y-axis is the concentration of degradation products. Well, when you have the breakdown enzyme along with the substrate, you're going to see a lot of degradation products, and that's what we see there. Now, when we add glycerotinic acid, which reduces the activity of the breakdown enzyme, reduces the activity of hyaluronidase 1, look what happens. Decrease of 54% of the degradation products. We're showing you here that it absolutely decreases the activity of hyaluronidase 1. On the flip side, we have glycine saponin, which, using the ELISA methodology of measuring, we see an increase in hyaluronic acid levels when glycine saponin is added to fibroblast cells in vitro. And you can see here untreated on the left, and you see so much more of that orange, which is the hyaluronic acid, is what we're showing you here, made by the fibroblast cells, which are those purple nuclei. Okay, so we have one antioxidant which decreases the breakdown, the other one which increases the synthesis, and then Heather is going to go into all of the data supporting the product. So glycerotinic acid inhibits hyaluronidase 1, leading to a decrease in HA degradation. Is that true or false? So this licorice root extract stops the ability of the breakdown enzyme, and therefore we see fewer degradation products of HA. Is that true or false? And that is related to essentially that first graph that I showed you, where it had that black line and the other line there in the presence of glycerotinic acid. Okay, let's see how everybody did. Ah, amazing. Everyone's listening. Yay. All right, that's exactly right. Okay, and now we have polling question number 2. Oh, that was polling question number 2. Okay, so now I thought I get another polling question. So now I am I have the great honor of introducing Dr. Willowy Lloyd, the director of the Skin and Color Division, just an absolute skincare expert. If you don't follow her on social media, you need to, because she puts out so much great material on social media. Dr. Willowy Lloyd, please take it away.
Thank you so much. That was a great presentation. I love learning about skincare, and that was just a fantastic presentation. So now I'm going to move forward. Let me take control here and talk about the full product portfolio for the Eucerin Face Immersive Hydration line. And most importantly, I'm going to present some really interesting clinical data. So I'm really excited to be here tonight to show this data to you. So before we start, we're going to have another polling question. So when recommending facial skincare products, what do you consider to be the most important aspect of that product? Is it your own personal preference, availability, affordability, proven clinical efficacy, or the formulation and ingredients? So of these 5 different things, what's most important to you when you're recommending a facial skincare product? And there's no wrong answer. I'm so curious to hear what people think and what's most important when they're recommending a product. So I'm very curious to see what you say. And remember, there's no wrong answer. And you know, I probably, for many of us, it's a combination. So most important is Proven clinical efficacy. I agree with that. I would say that is a leader for me also. And it's exciting because you're going to see a lot of clinical data in this section of the talk. So let's move forward and talk about the immersive hydration formulation technology. So we got a great overview of the basic science, and I'm going to go into the individual products and the studies on these individual products. So immersive hydration is a formulation that includes a multi-weight HA that Dr. Lane told us all about, and it also includes these antioxidant complexes, which are equally critical to the efficacy of these formulas. So they provide hydration, but also defend against free radicals. So let's talk about the 3 key features of this line. First of all, there's a 2000 kilodalton macro HA. This is the HA that sits on the surface, moisturizes the skin surface, like Ted talked about earlier. The second component is the 52 kilodalton micro HA. Now, this is the one that hydrates deep within the skin, and it goes into the different surface layers of the skin. So it's 2 components. That's why it's a multi-weight HA system. And then the third component are the antioxidant ingredients, which defend against free radicals and have other benefits, as Ted mentioned. So here you can see the full line. Of course, there's a cleanser, and the cleanser is a hydrating cleansing gel. I'm going to talk about it in a minute. And then we see the 4 other products that have these technologies that you can see right here. So there's a daily lotion SPF 30, there's a night cream, and then there's a boosting product. So there's some products that are additional, and we can think of the Moisture Boost Serum as an additional product. And this is, I think, very useful because hyaluronic acid is a very popular product for our patients. People love to use hyaluronic acid serums. So this Moisture Boost Serum can be used day or night immediately after cleansing, and then the moisturizer of choice would be put on top. And the 4th product there you see there is the gel cream. And the gel cream is a very unique, very lightweight hydration. It's a great hydrating product, but it's very lightweight, non-greasy, non-sticky. So an ideal formula for someone who wants lightweight hydration. So these 4 products all provide hydration. They defend against free radicals because they have different antioxidants. And most importantly, I think for our patients, is they're very cosmetically elegant. So they glide onto the skin, very lightweight, non-greasy, and fast absorbing. And those are key features that a lot of patients want in a moisturizer, because some of our patients, some of our acne patients, or some of our patients with normal to oily skin don't want heavy, kind of greasy feeling moisturizers, and all of these are great lightweight moisturizers that really provide great hydration. Now, we heard earlier Ted talking about the antioxidants, and antioxidants are a key part of these formulas. So there's glycerinic acid in the daily lotion SPF 30 and in the night cream. And then there's the glycine soya germ extract, or the glycine saponins, and vitamin E in both the daily lotion SPF 30, the night cream, and the gel cream. Those 3 products have those 2 antioxidants. And finally, the Moisture Boost Serum contains vitamin C, which is, of course, very popular with patients. I always say vitamin C is having its moment. People love vitamin C and hyaluronic acid. Those are very popular with my patients. So let's go into the Eucerin Hydrating Cleansing Gel. So this is a great multi-use cleanser. It's just great for all skin types. It cleanses without leaving the skin dry. I personally use this, and it's a very good cleanser, like, you know, a workhorse kind of cleanser. That's how I would think of it. Just a very good cleanser, cleansing without stripping the skin of its natural oils. It's also free of oil, alcohol, soap, parabens, fragrance, and it's non-comedogenic. So this is a really good workhorse type of cleanser that you can use for a wide range of patients. It does contain hyaluronic acid, and it is good for all skin types, including sensitive skin. Now we're going to go into these moisturizing products that have these key this key multi-weight HA system. So the Eucerin Immersive Hydration Daily Lotion SPF 30 is a broad spectrum SPF 30 sunscreen. It is a chemical sunscreen, so it's completely clear. So for your skin of color patients who don't want a sunscreen that leaves a white cast, this one is completely clear. It provides hydration that lasts all day. I'm going to show you some data on that. The wonderful thing I love about Beiersdorf, this is, as Ted mentioned, it's an international company. They do lots and lots of studies, and you're going to see a lot of studies this evening. It's clinically proven to hydrate the skin, it's non-comedogenic, and it's fragrance-free. So really good for your patients if you have normal to oily skin. It works great for all patients when you really want something that's non-comedogenic. This is a good day lotion with SPF. It also has the multi-weight HA system, so the 2000 kilodalton macro HA and the 52 kilodalton micro HA. And in addition to that, that antioxidant complex. Remember, these are antioxidants that go beyond the normal free radical quenching that we normally see with antioxidants, because some of the antioxidants have been shown to improve or increase hyaluronic acid in the skin. So there's the glycine saponin and the glycerinic acid and tocopherol, or vitamin E. So let's jump into a study with this daily lotion SPF 30. So this was a study of 35 women, 25 to 65. They reported mild to moderate facial dryness. They had visible fine lines and wrinkles, and they were the full Fitzpatrick skin type, so 1 through 6, including darker skin types. So 20% of the subjects were skin types 5 and 6. And they applied the daily lotion once daily in the morning for 8 weeks, and they were assessed at baseline 2, 4, and 8 weeks. So they were using this every day in the morning. And here you can see improvement in dryness and roughness and fine lines and in wrinkles. And you can see the 2 and 4 week time points here. And it's, we expect that you would see some improvement in all of these things with a moisturizer, but I am very impressed by the improvement in fine lines and wrinkles. Dryness and roughness we would expect, but they even showed statistical improvement in fine lines and wrinkles. And this was seen as early as 2 weeks. And this is one of the patients, and I think you can see my mouse here. You can see she has these very fine lines in her crow's feet area, and you can see at week 8 improvement in those fine lines in the crow's feet area. So really nice clinical results that you can see. Now, this is a very interesting study. It's a head-to-head clinical evaluation of the Immersive Hydration Daily Lotion SPF 30 compared to CeraVe AM Facial Moisturizing Lotion SPF 30. So in this study, it was a decent study. It was a nice large study, 70 subjects, and it was 1-to-1, women 25 to 65 years old. They had mild to moderate facial dryness, visible fine lines and wrinkles, and Fitzpatrick skin types 1 through 6, so the full gamut when it comes to skin type. And they used either of the product. They were randomized 1-to-1. So they either got the Immersive Hydration Daily Lotion SPF 30 or the CeraVe Facial Moisturizing Lotion SPF 30. They applied this moisturizer with sunscreen in the morning once daily for 8 weeks, and they were evaluated at 2, 4, and 8 weeks. So what do we see here? So we see here, first of all, that there is improvement in dryness, roughness, and fine lines compared to baseline. So the blue line here is the Eucerin Daily Lotion, and the gray line is the CeraVe AM. So compared both to baseline and also to the comparator, the Eucerin had improvement in dryness, roughness, and fine lines that you can see here at week 2 and also week 4. And these red boxes here indicate the statistical significance versus the CeraVe AM Facial Moisturizing Lotion. So if you look over here at week 4, we can see statistically significant improvement in dryness and roughness for the Eucerin Immersive Hydration compared to CeraVe AM in this study. Now let's move on to the night cream. This is the Immersive Hydration Night Cream. And again, this has the same formula that we talked about. Very important, because I think this is key to the efficacy that we're seeing in these clinical trials that I'll be presenting today. So the multi-HA system, the 2000 kilodalton macro HA, which hydrates the skin surface, and then the 52 kilodalton micro HA that penetrates into the deeper layers of the skin, and then the antioxidant complex of the glycine saponin, glycerinic acid, and vitamin E. Now you might notice here provitamin B5. This is the first time you've heard that. That's panthenol. And panthenol is used in skincare formulas because it's a very soothing formula. It just improves overall skin health, and it's a very popular ingredient because it has these benefits in the skin. So in addition to this, it also has the provitamin B5. This formula is non-comedogenic, it's fragrance-free, and of course, gives us long-lasting nighttime hydration, gives our patients that hydration. So this is a study looking at 32 subjects. They were women between the ages of 35 and 65, and they had sensitive and or dry skin. This is very important to me because that sensitive dry skin patient can sometimes be the more complicated patient because you can't just give them anything. You know, these are the burners and the singers. These are the people who feel that they have very sensitive skin. So I love that in this particular study, patients who were self-reported sensitive or having dry skin were used in this study, were participants in the study. So in this study, the immersive hydration night cream was applied twice daily to the inner forearm for 2 weeks, and they were assessed at baseline, 24 hours, and at 2 weeks. So what do we see here? So we see improvement in corneometry measures, and corneometry is a measure of hydration in the skin. And we would expect this. This is a hydrating night cream. So this is at baseline, this is 24 hours later, and at 2 weeks. But what I think is most interesting is that it's almost this dose-dependent response. We see this improvement in hydration over time with regular use. What does this mean for us clinically? What this means to me is that it drives home the point that consistency is key when it comes to skincare. Our patients probably, you know, they want to get better yesterday. They want to put on a cream and be better. And you do see immediate improvement. 24 hours later, there is increased hydration in that skin. But what I think is so important with regular use over this 2-week period, you see that this improved hydration increases over time. So I like this study because it drives home the concept that I tell my patients, you have to be consistent with your skincare. The more consistent you are, the better results you will see clinically. Now, this is a different study looking at the Eucerin Immersive Hydration Night Cream, and this is using a measuring device called the fast optical in vivo tapometry. So I'm going to talk a little bit about that. You probably haven't heard that term before. It's a relatively new way to measure fine lines, wrinkles, roughness, skin texture, and I'm going to go over this, but I love this data because it's very visual and we all love visual things. You're going to see some really beautiful images on how we can measure roughness in the skin. So this is a study of 42 subjects, women between the ages of 36 and 62, and they had self-assessed deep lines and wrinkles in the eye area. So they were applying the immersive hydration night cream twice daily to the assigned periorbital region. They were randomized left or right for 4 weeks. The opposite side was an untreated control. And then the assessment is this FOIT system, but I'm not going to use the abbreviation. I'll say the full name, which is a fast optical in vivo tapometry. And this measured basically average depth roughness, the depth of the roughness, which is the RZ measurement, and then mean roughness, which is the RA measurement. And this was done twice daily. And at 4 weeks, we see these results. So let's take a look. So first, before we look at those results, I want to show you a little bit more about that fast optical in vivo tapometry in the skin. So as I mentioned, this is kind of a device that scans the skin and it creates a 3D digital rendering of the skin. So it measures texture, smoothness, irregularities, and this includes pores, wrinkles, and fine lines. So I think this will be a very interesting device as we see more of these skincare studies because it really measures all of the things that our patients are concerned about: fine lines, wrinkles, pores, texture. My patients complain of poor texture often. This is a common complaint. Dullness, which is really a result of poor texture, and it measures this by scanning the skin and then delivering this 3D digital image. So the RZ value that was used in this study, that was measured in this study, focuses on the depth of skin irregularities, and the RA value provides an overall measurement of roughness, so this overall roughness. And so you can use these two parameters to look at how smooth the skin is. So you can see here, you can see how it's scanned. For example, the crow's feet, this is what the image looks like. This area under the eye, very deep lines, and you can see these very deep green lines here. This is on the cheekbone, and you can see those textural changes there, and this is on the upper lip. So I really like this device for many reasons, but mostly because it's very visual, and we love, you know, to see the data. So this is one of the patients in the subjects in the study. This is the periorbital region, and you can see that there is visibly smoother skin demonstrated in 4 weeks. So this is the person at baseline, and you can see that RZ and RA value. And this is the same area. Let's see if I can, there we go, at 4 weeks. So let me toggle back and forth so you can see it. So this is baseline, lots of texture, lots of green. Green is bad here because it shows the depth and poor texture, very rough skin. and the 4-week data less green. So I'll go back. This is baseline. This is at 4 weeks. And this is baseline again and at 4 weeks. I like to toggle back and forth so that you can see the difference. And it's a very unique device. I love the visuals that we see here. So now let's move on to the Eucerin Immersive Hydration Moisture Boost Serum. This is a hyaluronic acid serum, which is extremely popular with our patients. My patients are always asking me about hyaluronic acid serums and what's the best one to use. So let's look at the data on this product. So this is, again, the multi-weight HA system, so the 2000 kilodalton macro HA and the 52 kilodalton micro HA. In this formula, the antioxidant is vitamin C. And this has been shown to improve the look of fine lines and wrinkles. It quenches the skin. It adds hydration to the skin that lasts 24 hours, and it's non-comedogenic. So this is a really great hyaluronic acid serum for your patients. So let's look at the study. This is a study of 33 women, 25 to 55, with sensitive and or dry skin. Again, I love testing in this patient population because they tend to be the most challenging population when it comes to skincare. Those patients tend to complain about dryness and sensitivity. So I love that these studies are looking at our more complicated patients. And in this study, the Moisture Boost Serum was applied to the inner forearm twice daily, and then they were evaluated at 48-hour time point evaluations at 2 weeks, at 2 hours, 24 hours, 48 hours, 1 week, and at 2 weeks. And they were assessing moisturization with the corneometry, which looks at hydration in the skin, the moisture or water content in the skin. So again, we see this trend that we saw with the other study that was looking at hydration. So you see here that there's statistically significant improvement in hydration, which we would expect with a hyaluronic acid serum, but you see that it continues to improve over time. And this is statistically significant improvement compared to baseline, but 33 and 34, you see it going up. So this product moisturizes immediately and for 24 hours, and you see greater increases at 2 weeks, at 1 week, and then again at 2 weeks. So drives home that point, consistency is key. I suspect that if this study had gone on further, we would still see that increase in hydration over time. Now, this is another study with the Immersive Hydration Moisture Boost Serum using that FOIST system, which is the Fast Optical In Vivo Topometry. It's 31 women ages 27 to 55. They had self-assessed deep lines and wrinkles in the eye area. And the serum was applied twice daily to the assigned periorbital region. They were randomized left or right for 4 weeks, and the opposite side was an untreated control. And then they looked at the anti-wrinkle effect as determined by FOIS. And remember, that's measuring the average depth of roughness and the mean roughness of the skin. So what did we see here? So you can see here, this is one of the patients at baseline, and this is their baseline FOIS image, which you can see, remember, green is bad with FOIS because it shows roughness and depth of the texture on the skin. And this is at 4 weeks. So we'll go back again. This is baseline. This is at 4 weeks. There's less green, baseline, and again at 4 weeks. You see improvement. So we see visibly smoother skin at 4 weeks for patients who participated in the study. And now we're going to talk about the Immersive Hydration Gel Cream. And this is a very unique product. This is a new category that is very popular with patients who want lightweight hydration. And it comes in a jar, as you can see here. And it's different than the night cream because it's a very lightweight gel, so ultra lightweight, but still offers hydration. It moisturizes for up to 72 hours. It helps to restore the skin's barrier. But what makes it unique is this ultra lightweight, almost fluffy formula. I really love how it feels. And in studies, it's been shown to help smooth the appearance of fine lines and wrinkles. And of course, it's non-comedogenic. So good for your patients who are oily or acne prone and are concerned about using a moisturizer that could aggravate their acne or cause, more pimples and so forth. Again, as with all of the moisturizers in the serum, in this product formula, they all have the multi-HA formulation, which is a 2000 kilodalton micro HA, macro HA, and the 52 kilodalton micro HA. The antioxidant in this gel cream is the glycine saponin and, of course, vitamin E. So this is a study looking at 35 women, 25 to 65 years old, with mild to moderate facial dryness, visible lines, and wrinkles. They were Fitzpatrick skin types 1 through 6. All the skin types are represented, and 20% of the subjects were skin types 5 and 6. And they applied the immersive hydration gel cream once daily for 8 weeks, and then they were assessed at baseline 2 weeks, 4 weeks, and 8 weeks. And there was clinical grading of dryness, roughness, fine lines, and wrinkles. And you can see significant improvement compared to baseline at both the 2-week time point and the 4-week time point for dryness, roughness, fine lines, and wrinkles. And I think the dryness and roughness is not unexpected. We would expect a really good moisturizer to improve dryness and roughness, maybe fine lines, but I am impressed by this improvement even in wrinkles with moisturization with this formula. So very, very effective for your patient, but also lightweight, not heavy, which I think is very important for a lot of our patients. So let's talk about our key takeaways. What can you take away? First of all, moisturization is important for all age groups. And we've been talking about this multi-weight HA system. And I think it's great because it really does cover the whole range of patients. Your oily acne-prone patients who are younger and want lightweight hydration. But then we saw really great data on fine lines and wrinkles that would be more of a concern in your older or middle-aged patients. So I really love that this line is ideal across a wide range of patients, and the data that we presented tonight really shows that. HA obviously is a humectant, and it binds up to 1,000 times as mass in water, and I learned from Ted that it can be up to 10,000 times as mass in water. And so it's something that is a workhorse in dermatology. It leads to moisturization and also matrix rigidity. And we learned about how, we can increase HA in our skin with these special antioxidants. So the daily use of the Eucerin Face Immersive Hydration products has been demonstrated to show significant improvements in parameters evaluated in changes in moisturization as quickly as 30 minutes. But also we saw, which I think is most interesting, is changes in clinical grading in dryness, roughness, and I think it's most interesting, fine lines and wrinkles. And this was observed as early as 2 weeks. And the last point here is that utilization of the Eucerin Face Immersive Hydration products with the multi-weight HA system and antioxidants, because I think both of those are important. The multi-weight plus the antioxidants, I think both are important, provide hydration, helps defend against free radicals, but most importantly, enhances smoothness. The studies that I showed you on fine lines, wrinkles, skin texture, those are things that are most important to our patient, and they really have nice data to support improvement in those parameters. So now I think we have a polling question. So let's see this polling question. Based on the clinical data presented, will you recommend the Eucerin Face product portfolio more often, at the same level I do now, or less often? So I'm curious to see how you what you learned today and the interesting data that was presented, and we'll see whether you'd recommend it more often at the same level as you do currently or less often.
Heather, while you were talking, I was thinking about how in Europe and across the world, this is called, the immersive hydration line is called the Hyaluronic filler line. Yeah. As you were talking about improvements and fine lines and wrinkles, they really lean into that in Europe, but in the United States, we think of it more for moisturization, but it does everything. It's just slightly reformulated in the United States. So anyway, interesting. Oh, wow, look at that, Heather.
100%. Oh, this is fantastic. Well, I'm glad that you loved learning about this data. I'm very science driven. I know we all are. And it's quite impressive, and I think that's what you're seeing here. I agree with you. I learned about the Hyaluronic filler line in Europe, and it is a really effective product, I have to say. So I was very excited that Eucerin decided to launch it in the US. We have one more polling question. So next polling question is, which of the below would help convince you to recommend Eucerin Face with immersive hydration technology more often? additional published data showing clinical efficacy, a conversation with your medical sales rep, samples and coupons for your patients, sample for personal trials, so something for you to use on your own, or you would not recommend Eucerin Face more often. So I think all of you said you would recommend Eucerin Face more often. So I'm just curious to see whether it's more data or seeing a sales rep or samples and coupons or a personal trial that you'd like to try at home. Let's see what everyone said. Okay, looks like it's a tie. It's a tie between samples and coupons for the patients and samples for your personal trial. I think both of those are very, very important. I personally like to try everything. Everything we talked about today, I have personally tried and used. And so I like both of these responses. I agree. What do you think, Ted?
Yeah, I think it's great. And even if you don't have anything for personal use, I would recommend you just take one of your samples in your office and just try it and feel the texture and the dry off and all of it. It's just, you'll understand this is kind of a prestige feeling product at a lower price point.
Exactly. So I think that we have time for questions. It's exciting. It was fun to present that data and would love to hear your questions.
Thank you so much, Dr. Woolery-Lloyd, Dr. Lane, and I love that prestige product at a lower price tag. That was well done. I'm gonna learn that and use that. I love that wording. So, you know, it is amazing that a company like Barsdorf, not a drug company, have this much clinical studies, scientifically based, scientifically designed clinical studies. It's really amazing. It's very admirable. So we have actually a bunch of questions. We have a very enthusiastic audience. What would you recommend for patients who want a mineral sunscreen?
Well, I mean, Eucerin makes mineral sunscreens, right? They have it in their face line as well. So they have tinted mineral sunscreens. They have non-tinted mineral sunscreens. And I think Eucerin is really going in strong with the sunscreen line. So I tend to recommend their mineral sunscreens all the time, especially for my Accutane patients and my other acne patients.
How about this one? Were any of the patients allergic to tocopherol?
So actually, I know you did some of these studies. Were you about to answer that?
No, go for it. You know, we didn't show any safety, I don't believe, but no, go for it.
We didn't show any safety. As far as I know, the safety data was very clean, but I know that can be a concern for some patients. But you know, as far as I know, the safety data was very clean. It was not a trigger that we sometimes see with vitamin E.
What is the percentage of vitamin C in the products?
I don't think that is disclosed.
Okay.
Yes.
Well, next one is a nice comment. I appreciate a lot of these great webinars, and thank you for our speakers. Okay, this is really an interesting question, right? It always comes up. It's the $1 million question. In what order do you recommend your patients to put the moisturizer or the medication? Which one goes first? Does it really matter?
So I'll jump in on that because I love that question. And it's really interesting. So I'll tell you what I personally do, and then I'll answer, does it really matter? So what I personally do is I always say, and I'd love to hear what Ted and Leon's do, but I personally do medication first and then moisturizer second. And that's just, I developed that habit and I've always consistently done that. But the truth is, it doesn't matter. They've done studies. You can put medication first, you can put moisturizer first, and it doesn't change the efficacy of an acne. In acne, and I think the study was also done in rosacea, but I'd love to hear what you guys also say.
Ted, go ahead, and then I'll tell you what I will think.
You know, I think whether you put the medication or the moisturizer on first, that's totally up to you. We have the sandwich method of if you have a retinoid and you really need to be careful about retinization, you want to sandwich the retinoid between 2 layers of the moisturizer. I think another thing to consider is whether you put the moisturizer on before the sunscreen. Or you consider your sunscreen as the moisturizer. Now, that's a difficult question because there's conflicting data on the efficacy of sunscreen when it's applied after a moisturizer or before a moisturizer. And so I'm not sure that we have great data. I think what's great about this line in particular is that it's got sunscreen ingredients within the moisturizer, so you don't have to worry about applying a totally separate product. And I think that's probably where the compliance is best, when you have a moisturizing sunscreen. But if you think about it, especially with a sunscreen that has physical ingredients, it's a difficult formulation, right? Because you don't want the physical blockers to absorb into the skin. They need to lay on top of the skin. They're physical blockers, but all of the moisturizing ingredients need to penetrate the skin. So it's kind of, you're trying to achieve two different things with the moisturizing sunscreen, especially one that has physical ingredients in it. But Leon, you go ahead. What do you think?
So just like Heather, innately, I think the way we were taught that you put the medicine first and then you put the moisturizer on top, so that basically the moisturizer occludes the medicine and you get higher penetration. But we know that I was part of the study. We did actually tazarotene plus a moisturizer split face study, and there was absolutely no difference in efficacy when you count the pimples. However, there was much better results, better tolerability if you put the moisturizer first and then you apply the tazarotene. And then they did a very similar study with in rosacea patients with Finacea plus a moisturizer, and the results were the same. So actually, if you have a retinoid that is irritating, you're probably better off putting the moisturizer first and then put the medicine. But if you think about it, the human nature, innately, we are so automatically like prone to put the medicine first. That's what I was taught for years and years, and it's difficult to teach new tricks to an old dog.
Yeah, I agree. And then I'll complicate things more. My patients also ask about makeup, right? So,
yeah.
What the order of application. So what I tell my patients are, your prescription first, then your moisturizer with sunscreen, then the makeup on top. That's, how I tell my patients to apply in their order of application. But it does get complicated because you can end up with multiple steps. And I'm a big believer in simplicity when it comes to skincare and skincare order. So that's why I almost always, like 100% of the time, will recommend a moisturizer with sunscreen, because at least then you can skip a step most of the time, because then you don't have to put the moisturizer and the sunscreen. They're both together, and that simplifies it. And then makeup last if the person wears makeup.
So, recently what I'm doing in order to avoid the question, as long as you use it, I don't care in which order you use it.
Yeah, exactly. Just put it on your face, please.
Well, you know what that does? That improves compliance. This is what I keep talking about, consistent skincare. All of these studies are showing us that consistency is key. The more we use, even a moisturizer, the more hydrated our skin is with regular use. It's more hydrated at 4 weeks than it is at 2 weeks with regular use. So, whatever improves compliance is probably the right answer.
Yeah. I think we have time for one more question. What patients do you recommend Eucerin Face Immersive Hydration to?
Yeah, as I mentioned at the top, I think it's something that I recommend very frequently to my acne patients. It's really where I wanted to get the most experience with it, because I felt like if it was tolerable and improved compliance with my topical retinoids and the other harsh acne ingredients that we use, then it would be great for any patient. And so far I've had great results. I haven't had one patient who's come back, and we're talking probably at least 100 patients by now, who's come back and said, I couldn't tolerate this. It didn't feel right. I didn't like this. I didn't like that. Haven't had one, honestly. So I think that this is something that, one size fits all. I think this could be really used across the board.
Yes, and I agree. I like it for my acne, and I do a lot of skincare consults, a lot of pigmentary issues in my practice. So I need workhorse products that are not irritating, because I'm really pushing a rock uphill when I'm treating pigment. So I need to make sure that it's well tolerated, it's compatible with other products, because I'm going to be using some other products to address pigment. So yeah, I think it's a really good I keep using that word workhorse, but it's something that is reliable, that you're not going to get callbacks with.
But it's not only workhorse, but it's also a prestige.
Yeah.
So this was amazing. I'd like to thank Beiersdorf, makers of Eucerin and Aquaphor, to make this program available tonight. I'd like to thank our speakers, Dr. Valerie Lloyd, Dr. Ted Lane. I appreciate you being here, and thank you so much. Before I wish good night to everyone, I want to remind you about our new next program. It's going to be on August 29. Dr. Jonathan Rodriguez He's going to tell us all about the patient burden for chronic spontaneous urticaria and BTK-driven immune dysregulation. It's going to be a very exciting program. It's a whole new class of drug that we in dermatology are not familiar with, and hopefully we'll find out. Thank you again, guys. Thank you very much. Have a good night, everyone. Bye.
Thank you.
Bye.